Hi, thank you for joining us. Today I have Clara with us. Clara has been suffering with plantar fasciitis, and today I'm going to go through of how we actually will fix plantar fasciitis. I'll have Clara tell you how long she's been suffering with this. So go ahead, Clara.
Since 2005 I worked in a hospital, and from the workload, since then, from about 2006 I was getting steroid shots constantly, and they would last just for a few weeks, and then the pain and the swelling would come back, and with this treatment I feel great relief. Thank you.
Yeah, when she first walked in, she was really struggling putting her feet down on the ground, particularly with most of the patients that have had this. They'll tell you, getting up in the morning is one of the biggest chores, just to put their feet on the ground, just to get going to prep themselves to go to work or just go about their daily living. So with most of the patients who do suffer from this, it is a very chronic thing. Clara is not abnormal at all. Again, not everybody is fortunate to have the cortisone injection to help them with it. Oftentimes it doesn't make it worse, but it just really takes down the inflammation. But all the dysfunctional components of the fascia and of the shortened Achilles tendon, and oftentimes the misalignment of the foot can oftentimes just keeps the patient from healing up properly. So today we'll go through on how we actually work with patients that have plantar fasciitis. So first thing we have you do is go on your back for me, Clara, and we will adjust your feet for you, okay? So we will go through the basic feet adjustment that we do for our patients. All right, go ahead and relax for me, Clara. Stay right there for me. Good. I'm going to bring your foot out a little bit. Good. And relax me. Good. Nice job there. Alright, our objective with this is just trying to get all the range of motion back in the foot. Good. Nice job. I go through the same thing to the left side. Nice job. Usually we double check and see how well it's moving for her. Good. Relax your ankle for me. Good. Okay, relax your leg for me. And all the way back. Nice job. Good. Stay right there for me, Clara. Nice job. Good. This is very, very painful, not just for Clara, but for a lot of the patients that we do this on. So first thing we'll have you we'll do is put some biofreeze on the feet. So it just gives us a median to easily work on the fascia and the soft tissue of the feet a little bit better. And I usually put gloves on because it's this biofreeze can often dry out in the hands quite a bit. So let's put a little bit more front. Good. So again, so what we're going to do is we're going to break up this fascia here, all the way through here with the flexor digitorum brevis, all the way through here. And then we're going to strip all these muscles here on the medial side and the tendons here, and work on the Achilles tendon all the way down where it wraps around the calcaneus here. Okay. So the first thing we have you do is just relax there for me as much as you can right there, Clara. And again, all I'm doing is I'm breaking up the fascia and really working right along the arch here. And this oftentimes will restore the arch too for the patient. So we strip it all the way up right to the calcaneus, and you can see I'm putting a lot of pressure. You can see where I'm displacing the blood flow here, and you can see where it's white because we're putting a lot of pressure right through these fascia and tendons here. Again, there's not a lot of muscles in the feet. There are muscle, but we're talking about not a lot of muscle bellies. We're working on a lot of the tendons area and the ligaments. Good. Keep breathing for me, Clara. Nice job. Strip it right to where it attaches right through here. Good. Now what we do is we stretch this out. Again, we're bringing it all the way up to the calcaneus. Nice job, Clara. Keep breathing for me. And good. Again. Nice job. And then we stretch out. This is a really good stretch to stretch out the calcaneus tendon along with the plantar fasciitis of the plantar fascia and a lot of the flexors of the foot here. Good. Bring this all the way down. Now the other fun part is stripping out the tendon of the calcaneus here. So we're going to bring, what I do is I'm going to put pressure just laterally and we strip these muscles right down, and the tendon and the muscle. Do the same thing to this side. Again, I'm putting a lot of pressure. Clara is really being a good trooper here. She's not saying much, but I know she's in pain, so. But just a couple minutes of work of pressure really helps to break everything up, and it's worth it. So go ahead and stretch it out. Good. Push up for me, Clara. Good. And again. And relax for me, Clara. Again, this is a really good stretch that we do. We also teach a patient to do this against a wall to stretch out the calcaneus tendon right there. Push up again for me, Clara. And relax for me, okay? Nice job. All right, one last time, okay, Clara? Keep breathing for me. And nice job, Clara. Good job. So that's how we work and trying to get our patients to heal with plantar fasciitis, and hopefully this will help a lot of you guys out there who have any concern about going to a chiropractor to have your plantar fasciitis worked on. Thank you.
So as always, thanks for watching. Please like and subscribe for more. And if you get a moment, please check out our social media links below and our website at www.gulfshorechiropractic.com for educational health tips, information, and much more, which we think you'll love.